Welcome to The Explainer. Today, we're going to tackle a system that can feel, well, incredibly overwhelming right when you're at your most vulnerable. We're talking about navigating an orthopedic injury through workers' compensation. But don't worry, we're going to give you a clear roadmap to take control. So let's just start with a situation that is, unfortunately, way too common. You're at work, you're just going about your day, and then bam, an accident happens. Maybe it's a slip, a fall, or a strain from lifting something heavy. You're in pain, right? You're probably worried about your job. And on top of all of that, you're suddenly thrown into this complex world of forms and rules and terms you've never even heard before. It's a confusing, anxious time, for sure. But this explainer is going to give you a clear map to follow. Okay, so you've been injured. Your first priority, always, is getting immediate medical care. But once that initial emergency is handled, your reality completely shifts. What comes next is a whole new process, and it really requires a different way of thinking about your healthcare. And this right here, this is a really critical shift in perspective. Your path to recovery is now totally intertwined with a specific legal and insurance framework. And honestly, understanding how this system works is the absolute first step to navigating it successfully. Okay, so let's dive into this. To get through this new territory, you got to speak the language. It's not as complicated as it sounds, but knowing the key terms is absolutely essential. We're going to break down the two most important concepts you'll run into right away, so you're never caught off guard. So, at its core, this is what's called a no-fault system. What does that mean? It means it's designed to cover your work-related medical bills and a chunk of your lost wages, no matter who was at fault for the injury. It's basically a safety net for workers. And this is where it gets a little tricky for a lot of people. The crucial point here is you usually can't just go to your regular family doctor. Instead, you'll be given a list of pre-approved physicians, and you have to choose from that list. Now, when you see it broken down like this, it's really interesting how different these roles are. Your family doctor, they know your personal health history, but a workers' comp doctor, they understand the very specific documentation and reporting that the insurance carrier needs. Their job isn't just about treating you, it's also about determining your ability to work, and that is a huge distinction. So, now that you kind of know the rules of the road, it's time to take the wheel. This next part is where you have the most power, and frankly, it's where you can make the biggest difference in your own outcome. The choice you make from that approved provider list, it can seriously impact your entire recovery journey. And this just brilliantly illustrates a clear, manageable process. Please don't just pick the first name you see. Get that official list and then do your homework. Here's a key tip. Look for doctors who have a subspecialty in your specific injury, like a hand specialist for a wrist fracture, not just a general orthopedist. Also, check how long they've been working inside the workers' comp system. Trust me, that experience is invaluable. You have to arm yourself with the right questions and go beyond just their medical qualifications. Ask things like, what's your process for determining my work restrictions? Or how do you communicate those to my employer? Or even, how responsive is your office staff to patient calls? Because, let's be real, the administrative side of a workers' comp case can be a massive headache. Finding a doctor with an efficient, communicative office is a total game changer. I mean, that really puts it all into perspective, doesn't it? This decision, it's not just about medical treatment. It's about the entire path of your claim and your return to health. This just underscores why taking your time and being really thorough in this step is absolutely critical. Okay, so once you've chosen your physician, you become an active partner in your recovery. So let's take a look at how you can actually take control of that journey and make sure you're on a successful path forward. It is so vital to know that you have rights in this process. You have the right to a clear explanation of your diagnosis and your treatment plan. You have the right to get care in a timely manner. And, crucially, you often have the right to request a second opinion. Don't ever be afraid to use that. A good doctor will respect that you want to be fully informed, and it's a critical check and balance for your own peace of mind. Knowing your rights empowers you to be your own best advocate. So, the crucial point to take away from all of this is that this process is ultimately about your long-term well-being. The system, the doctors, the treatments, they are all just tools with one single goal: to get you back to your life, healthy, safe, and ready to move forward. We started with all that confusion and anxiety of a sudden injury, but now you have a real framework for understanding the system and making informed choices. We've turned that confusion into clarity, and our goal is for you to feel empowered to navigate the road ahead. So the real question is, are you ready to take control?